Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental practice broker for 15 years. Today's topic is the most stubborn seller of a dental practice we've ever encountered in 15 years. Simply will not listen. We'll get into that. Before I do, as you know, we have 10 employees now, including 2 CPA accountants, marketing director, operations director, development acquisition team. And we are available to you 363 days a year, except Christmas and Easter, so call us. You can reach us at 201-663-0935 or go to our website, dentalpracticeguide.com, or Nationwide Dental Practice Brokers. I'll be happy to give you some advice, even if you just want to chat. So, everything you're about to hear is for entertainment purposes, not legal advice. And remember, if you're selling to a large DSO, we will, and the practice is, large, what they're looking for, over 1.3 million. Give us a call about that, because often we work with brokers around the country. We work with DSOs around the country, and 140 of them, in fact, there's more than that. They will often pay our commission, so the most likely will be no commission to you. In addition to that, if the practice sells for over $1 million to a successful closing, we will reimburse the seller legal fees if it closes for over $1 million successfully. Anyway, we've done that multiple times. Did that like 2 weeks ago. So listen to today's issue. This is the most stubborn seller of a dental office I've ever encountered. Number one, will not listen to logic, will not listen. I got 15 years in experience, 25 years as a dentist, and does not want to listen. Obviously, I have to change some of the facts about this. The dentist had a small fire, smoke damage, in one of these, I think 4 operatories. It was a large place. It was like 12 operatories, and smoke damage to I think 4 of them in a distant part of the office. So it has to renovate. I got the insurance money to renovate. So he's thinking about renovating, and the materials he wants to use, I'll give you an example, although this is not exactly it. I have to maintain confidentiality. If you're redoing a kitchen nowadays, the vast majority of people will not use Formica. I understand Formica worked at one point 20, 30 years ago, 40 years ago, but those days are over. Okay? Nobody uses Formica. I appreciate the benefits of a Formica countertop because it's easier with leveling it out and everything. It doesn't have to be as level as the new stone countertops to have to be now. It has its advantages, but it's old. Nobody wants Formica. And a young person coming in to buy a house, they're going to look at the kitchen, which is one of their bigger selling points, right? And you would never, if you had to renovate because you had this smoke damage, and you want to renovate your kitchen, you're never putting in Formica, okay? There's simply no reason. If you bring 50 realtors in, every single realtor is going to tell you it's going to be some form of stone. Right now, in year 25, it's quartz. Quartz is hot. Granite is out, but granite was in for a while. Quartz is hot. Quartzite is in. But quartz and quartzite are hot sellers right now. Maybe an occasional granite, maybe. But it's stone. Everybody wants stone countertops and maybe some kind of tile backsplash or stone backsplash, right? That's what you're current buying. So let's say you're renovating your kitchen. You want to be happy. You want to be contemporary. And you got to think in the back of your mind for resale. Because something crazy could happen and maybe you'll hit it big and buy another house. You want to be able to sell your house, kitchen and bath, sell the house. and nobody is using Formica countertops. Well, this dentist, it's not the countertops, it's something else, is renovating these 4 or 5 rooms, whatever it is, because of smoke damage, let's say, and they don't want to listen. They don't want to listen of what the average 99.9% buyers are looking for in an operatory. They're looking for clean, sleek, no garbage on the countertops, vinyl plank floors. They want, they're looking, some of them aren't even looking for the white wood tone cabinets. Some of them want the white cabinets. That's kind of, they have an image that they want. Now, the way in which this doctor, hold on a second, I'm going to intersection. Remember, always stop talking at an intersection. Can't think and go into an intersection at the same time. Little tip, Dr. Gary here. Also, I'm losing weight, by the way. You guys notice? I've already lost 13 and a half pounds. I want to lose 30 because I want to live to over 100. And there are no overweight people that make it to 100. So therefore, I'm trying to lose 30 pounds. So through these series of videos, you're going to notice I keep losing weight. How about that? Okay, I'll just get back on subject. So virtually no, if you're going to renovate an office, you should at least keep in mind, and you want to sell your office, wouldn't it be smart to build an office in such a way that it will appeal to the younger buyers? So bringing in multiple buyers for 15 years, I think I got a pulse on it. I could say that I'm an expert. I know what they want. And nobody wants the quote-unquote Formica cabinets. Not that that's what this is here. Nobody wants that. And the way in which this doctor wants to renovate these smoke damaged operatories, I can't believe how they want to renovate it. I told doctor, no buyer is going to like that. When you renovate the way you want to renovate, first things buyer is going to say is, I have to have extra expense, just like putting in for my account or whatever. I have to spend extra expense just to rip out what this doctor is doing. I don't know what to do. I've never had a seller this stubborn. I mean stubborn. You have a seller that is living in the dark ages, a seller that will not listen. A seller wants it their way. Now, how do I get through? What is my technique of getting through to this seller to tell them, Doc, you simply have no clue in what you're doing. I don't want to turn them off, but you got simply no clue in what you're doing here. You're way off base. You're going to turn the buyers off. You're going to make it more challenging to sell your office. As it is, the office is antiquated because in which the way the doctor decorated it in the first place. You would think if you're going to renovate, bring it up to standards. Bring it up to what the buyer wants. You are selling the office, doctor. It's only a matter of time, so you're not going to be there long term. You're going to be there short term. So why would you make an office that is 50 years old? What are you doing? This is where the emotional part comes in with, when you're dealing with sellers or buyers. It's going to be a challenge. And we come across this as brokers often. I have 25 years as a dentist, 15 years as a broker. Maybe I learned a few things along the way. But I wouldn't have done this, 40 years ago. I wouldn't do renovations like this doctor's doing now. Just crazy. How do you get through? My plan is very simple. I'm going to get through to the closest advisor I can of this doctor, whoever that may be. Maybe it's a staff that knows about the sale. Maybe it's an office manager. Maybe it's a spouse. Maybe I'll say to the doctor, can you at least let me talk to your closest advisor? Can I share my opinion? I don't want to get in an argument with them. And we left it at, we basically don't agree on something, but, we're still cordial to each other. But what this doctor wants to do is just not making the sale more saleable, because young doctors come in, they essentially want to walk into like a clean hotel room, clean shelves, everything is neat, no garbage on the shelf, no clutter, clean, sleek, walk-in condition. Did you ever see the kitchens nowadays and you walk in and you don't see any clutter, everything is clean lines and there's no clutter, nothing, it's clean, and that's what the buyers are looking for, clean and sleek. But not this seller. He or she won't listen to me, and I have to do whatever I could do. I think what I'm going to do is get to the closest advisor. I'll work on that. We'll keep you posted what happens. But if they don't, they're going to make the sale harder, and they don't listen. So you as a seller, you got to keep your mind open. You got to look at what you would like to do in your renovations or repair. What is the buyer looking for? Because you're trying to sell your office. Don't make it harder. Make it easier. What is this buyer looking for? What do they want to see today? Forget about my personal opinion. What does this buyer want nowadays? And that's what your focus should be, especially in a situation where you're forced to renovate. So just some ideas. Listen to the broker. Keep your mind open. And if you're so stubborn, you as a seller, turn to your closest advisor and ask them what they think. And maybe you'll get somewhere. All right, team. We'll see you soon. Please hit the subscribe button. Hopefully in about the summertime, I think July is my target date to lose 30 pounds. So I'll be looking younger. Goodbye.